respiratory and sleep physician based in Sydney. I have 20 years experience as a practicing doctor and 12 years experience as a respiratory and sleep physician. Most of my working life had been spent working in public hospitals, and for the last 6 years I've started my own private practice at the Sydney Respiratory Specialist Clinic here. And it's during this private practice that I mostly noticed that there are many issues I'd like to discuss with patients that are not clinical, they're non-clinical issues, but affect the clinical outcome of the patient vastly. If I'm seeing this a lot in my patients, this must be a problem in the general public as well. With that in mind, I started this YouTube channel so that we can discuss certain issues and topics to improve health outcomes. I would like to state that this is general medical education. This is not tailored medical advice. If you have a medical condition, you need to see your GP and get referred to a specialist for medical advice. Let's dive in. 10 tips. Tip number 1, which seems extremely obvious, but oftentimes disregarded. That is, arrive early. Not on time, early. Give yourself time to find your parking, find where the specialist office is, fill the paperwork. That takes time, longer than you think you need to. Arrive early. Number 2, ensure that your referral is sent in advance. Try not to bring your referral on the day. That just didn't give the specialist time to look at all that information, gather more information if you require to, look at the CT scans, look at the blood tests or any other tests, any other specialist letters that you've had before if you don't provide it to the specialist. It is so valuable. That information is gold for the specialist looking after you, to have a baseline background understanding of what is really going on with you even before you come in. Number 3, communicate your needs with the reception staff earlier on. If you have a complex medical condition, if this is a second opinion, or if English is not your first language and you need an interpreter, inform that early so that we can give you a longer appointment of 45 minutes to 60 minutes. Number 4, know the purpose of your visit. This seems quite obvious, but there have been times when the patient just does not seem to exactly know why they're there. It is very important that you know why you're referred so that we can address your concern specifically and understand what's troubling you and make a good management plan. Now, the next one is something that happens often to most patients, which is forgetting all the questions they wanted to ask the specialist. They had so many questions, they've written it down in little pieces of paper, they've written some down in the phone, but they've forgotten the phone now and they have forgotten all the pieces of paper. Write down your questions and bring it to the appointment so that we can go through those questions one by one, and you will feel a lot more satisfied when your questions have been answered properly. Number 6, bring a support person. And this becomes extremely important, especially if you know you're going to get bad news. Or even if it is not bad news, if it's a complex diagnosis, which most often if you come to a specialist clinic, you are looking at somewhat complex diagnoses and possibly a couple of investigations to do, and maybe to see another specialist. This may be too overwhelming. Maybe it's too much information in one go just for you. If you have a second pair of ears to listen to this, it would be extremely helpful. But make sure that you bring someone who's going to support you and not take over the conversation and dominate the conversation about their medical issues. That does happen too. Number 7, engage actively. In this day and age, it is very important that we try to have a back and forth communication. So for example, I understand what is your problem, what is your lifestyle, how compliant are you with medication, how busy is your life, and do you agree with this management plan? So we could tweak the management plan. There's so many options available and so many ways to deal with the same medical problem that we can tailor it to the patient. And in this era of personalized medicine, if you don't speak up and tell the specialist what your concerns are, it is very difficult then for the specialist to tailor the medication to you, and you will be given the standard treatment that anyone would get. But if it's tailored to you, you'd have a far better outcome. You would feel that it suits your lifestyle better, therefore you're more compliant. Number 8, stay focused on the health issues. You need to use your appointment time wisely. Usual first new patient appointments are about 30 minutes to 45 minutes. A complex appointment, 45 to 60 minutes. You want to use that entire time to discuss your medical problems, discuss your concerns, discuss your anxieties, and make a management plan. This time should not be wasted on complaints about other issues. For example, if you've been in a hospital recently and now you're discharged and you're seeing me for a follow-up appointment from the hospital, you may be pleased with the hospital stay. Equally well, you may have some issues with the hospital management. Don't use this time with the specialist to discuss those issues. Use this time wisely for the medical problem and make the complaints or suggestions that you have about the hospital to hospitalize them. It is the same with the clinic settings. If you couldn't reach the specialist in a timely manner, if you didn't receive the confirmation letter on time or any other complaints, talk to the practice manager. Leave your precious time with the specialist to discuss your medical issues only. Number 9, avoid discussing financial issues. Discussions regarding payments, discussions regarding how much would a pathology test cost or how much an X-ray or a CT scan costs has to be pre-discussed, and it is usually not under the control of the doctor as to the costs that are incurred during radiology and pathology testing, and try not to bring those financial considerations, which are important, but it's important to discuss it before the appointment or perhaps after the appointment with the practice manager or the hospital, but not try to take time out of that precious time you had with your specialist discussing these financial issues that the doctor really can't help you with anyway. Number 10, choosing the right specialist. This may seem quite obvious, but if you really think about it, last decade or two had seen tremendous improvement and increase in the medical knowledge and the technologies that come with it. So therefore, even in the same specialty, there are many niche subspecialties. So you may know what's wrong with you. For example, if you have had a CT scan for something and now you have a lung nodule that's suspicious of a lung cancer, the best person undoubtedly to be referred to is a respiratory physician so that you can be worked out. But again, a respiratory physician who has experience in lung cancer management, who does interventional procedures like bronchoscopy or EVAS, and who also participate in lung cancer multidisciplinary teams would be the ideal specialist to go to, because that way you'd be worked up faster, your appointments will be booked earlier, and you will have your bronchoscopies and biopsies, everything booked even before you see that specialist, because that specialist does all of those things. However, you may also have a problem that is more generalized. For example, you may be short of breath or you may be having a cough. Now you need a generalist, you need a good respiratory doctor who is interested in all of the respiratory problems, so they could really focus on your medical condition and narrow down and give you a management plan. This seems quite difficult, to navigate all of this and find the right specialist. And I would say the best place to start with is your GP. Your GP would know who the local specialists are that would be ideal for your condition. The next best way is to search up the specialist that you're referred to. All of us list down our qualifications, our the master's degrees and the PhDs we have, all of the experiences we have. According to the APRA guidelines, we would put everything on the websites. So you could really go through and find out what the special interests are, what the training is like, and what the experience is like. Overall, it is worth taking your time to find the right specialist. I hope you found these tips helpful. I would love to hear from you, and any comments you have and any experiences you had, good or bad, with a specialist appointment, so that would help me improve my practice as well as help patients. Thank you for watching, and don't forget to subscribe for more insights and information.